Good morning, everyone, and welcome to the Safety Action monthly webinar. I'm Andrea Rowe, General Manager of Safety Action, and joining me today is our Senior Consultant, Dr. Stephen Webber.
Good morning.
This morning, we're going to share some of the important updates that featured in our latest quarterly legislative update. So our safety helpline customers would be familiar with this legislative update that we prepare every quarter to keep you updated to the changes in the safety law and guidance from the authorities, and also recent safety prosecutions. So this morning, we're going to tell you about some of the recent safety issues, including some new manslaughter laws in Victoria and the new recommendation to wear face masks in Victoria. We were asked an interesting question about whether disposable face masks can be reused. I'll tell you about this later. Now, if you're watching us live this morning, you can download a complimentary copy of the Q3 legislative update, which is on the GoToWebinar panel under handouts. This, as I mentioned, our safety helpline subscribers receive these quarterly. So this morning, firstly, for legislative updates, I want to give you a quick update about dangerous goods changes in Victoria. So many of you that have been watching the news might have been hearing since late 2018 that there have been some serious incidents relating to the poor storage and processing of waste, and some stockpiling of large quantities of dangerous goods. Those in Melbourne may still remember the smell of the West Footscray fire late in 2018 that made a lot of people sick in Melbourne. And now in more recent news, against some of these operators, there's been several charges laid and for breaches of the Dangerous Goods Act and regulations. So court proceedings are now starting against these operators. So this has resulted in changes in the, prompted some changes to the dangerous goods regulation in Victoria. So last year, the penalties for breaching the Dangerous Goods Act was increased to 10 years in prison for a new reckless conduct offence, and financial penalties were increased to about $3 million for businesses breaching the Dangerous Goods Act. Following this, the Victorian dangerous goods laws are now under review to help stop the unsafe stockpiling of dangerous goods and chemicals, and to punish offenders for flouting these laws. For those of you that do store or handle large quantities of dangerous goods at your workplace, keep in mind that these law changes are aimed at those that are deliberately and recklessly flouting the safety laws. However, WorkSafe Victoria have begun taking a more proactive approach to compliance monitoring for dangerous goods storage. And so they've actually established a new team developed dedicated to checking compliance and supporting businesses to be complying with their dangerous goods obligations. So if your business is a licensed premises, that is, if you store dangerous goods in excess of the manifest quantities and you've notified WorkSafe of this, you might be contacted by a WorkSafe representative requesting you to provide them information to demonstrate your compliance, such as they might want to see your dangerous goods manifest, maps, and safe operating procedures for handling dangerous goods. So that's my update about dangerous goods. Please let us know if you have any further questions. Throughout this webinar, you can actually put questions in the GoToWebinar panel, or you can email us any questions and we'll get back to you. Now I'm going to hand over to Stephen to tell you about the new workplace manslaughter laws in Victoria, and he's also going to tell you about some work he's been doing about COVID return to work plans. Over to you, Steve.
Cheers, thanks, Andrea, and good morning, everybody. Thank you for joining us as well. So probably one of the bigger shakeups in OHS prosecutions over the last couple of years is the various states introducing workplace industrial manslaughter legislation. And Victoria is the latest state to finally implement this, coming into effect on the 1st of June this year. We haven't fully seen any prosecutions coming out of it yet, but we probably will in the near future. But it's really interesting to note the differences in Victoria versus the other states. One, our penalty is equal to or slightly higher than the other states. Businesses can be fined up to about $17 million, and they increase the penalty in draft to 25 years potential jail time for individuals that are prosecuted under this offence. So it's pretty significant penalties. We do want to caution or console individuals that as long as you have a compliant and active safety program and plan in place, this shouldn't impact you any differently than any other law or prosecution or potential prosecution that came before it. However, Victoria is also slightly interesting in that this law applies to anyone you hold a safety duty to. So this includes visitors, members of the public, etc. The other states, or they're just are only contained for those that are workers. So it's kind of that interesting irony in Queensland. This was introduced about the Dreamworld prosecution, where members of the public were killed in the ride accident. And the legislation they introduced wouldn't actually apply to the case because those aren't workers under the legislation. So bearing in mind that members of the public, workers, contractors, subcontractors, everyone we hold a duty to in Victoria, the law industrial manslaughter will apply or potentially applies in the case of work-related injury, death. It's also interesting to note that we've had recent clarification from the Workplace Safety Minister that these fatalities also extend to such situations as work-related public road accidents, suicide from OHS failings, so death from industrial disease, or mental illness arising from OHS failings that lead to death at a later state in the person's life. So not only are these industrial accidents within the workplace that we failed to meet, we are actually sort of extending that obligation to, okay, well, your duties, as long as it is work related, this legislation can apply. So it's quite likely that the other states will adopt this definition of a workplace fatality, and it certainly is an extension of the obligation is to protect these workers from these injuries is always there, but this is more of a formal extension of that responsibility. So bear that in mind. The other thing we really want to flag is, well, the flavor of the year is COVID-19 and coronavirus, and we here in Victoria are entering into our second lockdown. The first thing I want to flag is our wishes for your health and the health and well-being of your employees during this time. I'm already hearing from some employees that this lockdown is much more mentally stressful and difficult for their employees. So I would strongly encourage everyone to access as much mental health resourcing as possible and reach out as much as you can to your workers. mymentalhealth.org.au is a federal government sort of listing page of multiple online mental health resources, etc. So links to Beyond Blue and other government-based funded mental health resources. I would strongly encourage anyone to access those because we all need to make sure we look after each other during this time. So COVID-19 is flaring up again, unfortunately. I think we really have to start acknowledging as a business and a workforce workforce that this is the new normal. We need to stop looking at this as a fight it, cure it right now and move on back to what we were. We need to start integrating these practices as long-term processes that we're going to have to deal with. So every business right now should be having building and implementing a COVID safety management plan and process within your organizations. Some of the critical things that you need to look out for are clear communication on your procedure for any sort of illness symptomology, ensuring everyone within your organization understands what those illness categories are and the consequence of if you have those symptomologies. I strongly encourage you to make sure that you build in what happens if you present to work with symptomology, and that is communicated and understood to all staff. Because if somebody starts to fight you saying, no, I've just got hay fever, I've just got a cold, etc., you need to have a very clear protocol in place for your supervisors, your managers to fall back on to ensure that you can manage that employee correctly. That ties into the next point. Ensure you have very clear leave protocols around COVID-19. If you go into a shutdown, if an employee is stood down temporarily because of symptoms or illness presentation, if their kids are now no longer able to go to school, what are the leave protocols your business is putting into place to manage that? Because if that is clearly and easily understood and defined, then it significantly reduces stress and uncertainty within your workers, which is critical in this kind of environment and time. So also have a very clear protocol or emergency response plan in the event of an outbreak. What happens when somebody actually is diagnosed with COVID symptomology? So from a procedure point of view, I strongly encourage those to be in place. Then you start to move into more practical controls of COVID-19. How do we actually keep ourselves as safe and secured as possible? So things like minimizing contact points wherever possible. So every door that you don't need for security, can we jam it open so we reduce people touching it? Testing stations at the front door from temperature checks. What kind of PPE do you want? Andrea is going to talk a little bit about masks just after this. Are you going to put masks in your workplace? Critically, teams. Building your organization into as smaller groups of teams as possible and having them almost be isolated silos as much as possible. This minimizes business impact in case somebody presents with symptomology, because then the team can be isolated and minimizing the impact across the whole organization. And then all the hygiene protocols that we're seeing coming out of government and organizational practice. If you need any sort of assistance or support in ensuring that your organization is COVID-19 best practice ready, do give us a call or contact us. We have a number of tools and guidance and services that we can provide to assist you in this case. But otherwise, stay safe and look after each other throughout the various levels. Managers, make sure that you check in with each other as well. We don't get lost out in all of this, looking after everyone else. But an interesting question that has arisen lately because of all the government discussions on use of masks to protect people in the public and in the workforce. Someone was asking, given the restrictions or potential supply issues, can we actually reuse disposable masks? For that, Andrea is our expert on that, and I pass back to her to answer that interesting question.
Thanks, Steve, and thanks for your interesting and important update on managing COVID-19 in the workplace. So those of you outside of Victoria, those in Victoria would be aware that last Friday, the Victorian Premier changed the previous advice regarding face masks and made the recommendation that where social distancing may not be possible, such as in supermarkets, that face masks should be worn. And I've now been asked if all workplaces must now enforce the use of face masks. The answer is no, not in all situations. However, you should be heeding this advice where social distancing can't be achieved. So there's many workplace situations where the recommended distancing, at least 1.5 meters, is not possible, such as some manufacturing areas, packing lines, construction sites. For example, jobs that need 2 persons in a scissor lift, they can't achieve that distancing. Kitchen environments. There's many situations. And so in these situations, the use of a face mask is advised. It's important to note, however, that if used incorrectly and not handled correctly, face masks do pose the risk of actually spreading germs. So, it's important that you use the proper hygiene when putting on and taking off the face masks. So I'm applying hand sanitizer before I touch one of my disposable masks here. So many of you will be aware, if you're actually wearing this mask to protect yourself, from respiratory droplets, and I know many of us are guilty of this when we wear it to the supermarket for 5 minutes. If you then wear this mask and then when you're taking off the mask, you then touch it, or you don't store it properly, and if you don't, we're supposed to put them straight in the bin. They are intended as single-use item. And the problem is that if we don't dispose of it correctly, when we touch this surface, we actually could be contaminating our hands and then spreading the germs over a lot of other things. But given the limited supply, and I know the cost of these single-use masks, especially if you're only using it for 5 minutes, I have been asked by a client, can we request workers to actually reuse the face masks? So what is critical is whether you're using them for single use or multiple uses, workers need to be trained in how to hygienically apply and remove the mask. Now, you can certainly consult with your workers about whether your situation might allow you to reuse the mask. And I've actually attached a handout as well about this, giving some information about how the disposable masks can be reused. So you might be aware that, these, if wearing it, I guess, for a full day, these masks are suitable for around 4 hours of use, depending on the environment. And so if, for example, you're only using it for a short time, if you handle it correctly, you could safely reuse the mask. For example, before removing it, again, applying your hand sanitizer, and then, folding the dirty side of the mask and then storing it correctly in a paper bag or other holder. But remember, there certainly is the risk of contamination. So if you do want to introduce this practice, it's really critical that you train your workers specifically in how to do this, and also give information to your workers so that they know when the mask is not suitable to be reused. So, for example, if the mask is damp or it shows any sign of dirt, and I recommend you give your workers the right to replace their disposable mask as frequently as they feel necessary for their health and safety. Now, that's all we have time for this morning. If you do have any further questions, feel free to send them through to us, and we will get back to you. If you'd like any more information about our legislative updates or any of the topics we've talked about today, please get in touch. And thank you, Steve, for being part of the webinar, and thanks everyone for attending.